All right, well, the current time is now 1:05, so I think we can get started. Just want to say hello to everyone. My name is Scott Tanaka. I'm with the Center to Champion Nursing in America, filling in for Jasmine Cooper, who's not in today. But I'd now like to pass it off to Winifred Quinn, Dr. Winifred Quinn, who is the Director of Advocacy and Consumer Affairs here at the Center to Champion Nursing in America.
Great, thank you, Scott. Hi, everyone, and welcome. Thank you so much for taking time to join today's Learning Collaborative. We are excited to have Tara Spencer and Juana Rodriguez join us today from the Health Resources and Services Administration, also known as HRSA, who will be sharing information regarding some of HRSA's funding opportunities. Our goal for today's call is to make sure that the HBCU schools of nursing are aware of federal funding opportunities available to them or to you. Before we go much further or any further, I do want to mention we are recording today's webinar. If you miss a section or would like to pass it on to a colleague, which we highly encourage you to do, you can find the recording by going to www.campaignforaction.org/webinars. Now on to our two presenters. For the sake of time, I'm not going to read their full bios, but they will be available on our website along with the recording in just about a week's time. First, I want to introduce you to Ms. Tara Spencer. Ms. Spencer is the Chief of Nursing Education and Practice Branch with the Division of Nursing and Public Health and the Bureau of Health Workforce with HRSA. Our second presenter is Juana Rodriguez. Ms. Rodriguez is an education program specialist for the Nurse Corps Scholarship Branch within HRSA, the Bureau of Health Workforce, Division of Health Careers and Financial Support. So Tara and Juana, thank you so much for joining us today. So Tara, please take it away.
Thank you, Dr. Quinn. Good afternoon, everyone. Thank you so much for that warm introduction. So today we will be giving you an overview of the Bureau of Health Workforce Programs, or what we call BHW here at HRSA. So BHW's mission is to improve the health of the underserved and vulnerable populations. And we do this by providing community-based training of a skilled healthcare workforce, loan and scholarship programs that incentivize clinicians to work in rural and underserved communities, and health professional training grants that allow for innovative and flexible responses to the nation's emerging healthcare challenges. So to support our mission of strengthening the health workforce and connecting our professionals to the communities in need, BHW administers over 40 workforce programs, and we had a total fiscal year 2019 budget of $1.55 billion. So BHW, our resources impact every aspect of a health professional's career. So we call it our pipeline of education and training to service in the community to continuing education. So these four outcome categories are not necessarily mutually exclusive. Conceptually, they intersect with one another, and many of our programs are designed to attempt to address the multiple categories. So this is what we call our outcomes framework. So access we define as the ability of patients to access available services and the linking of appropriately trained providers to those in need. So in BHW, our programs focus on the care provided and training to provide that care and ensuring that they both reflect the services necessary in a particular community. We also make sure that we look at the appropriate mix of providers when we're talking about access. So supply we define as an equilibrium or sufficiency between the number of individuals needed in healthcare and healthcare support occupations in the US in order to meet the demand for the healthcare services they provide. So what this looks like in BHW is these are our programs that are aimed at correcting the issue of supply, and those result in our new practitioners that we have. In terms of distribution we define as the number of individuals training, serving, or employed in a specific geographic area. So for us, the geographic area could be rural or underserved, or a common geographic unit like a state or a county. So in contrast to our programs that are looking at correcting the supply of new practitioners, these BHW programs are aimed at incentivizing the geographic redistribution of the current providers. And then quality we define as a healthcare and health support workforce that is trained in employing evidence-based techniques that reflect patient-centered and culturally competent care, which will have an end result of better patient care. So quality can also refer to the provision of care that follows accepted practice standards. So these are what we look at in terms of our programs and what we look for outcomes and how we disseminate that information and how we show impact to our external stakeholders as well as to Congress. Next slide, please. So how do we recruit and retain providers to choose careers in rural and underserved areas? Here you will find BHW's 6 strategies for success. So we do that by training our students in rural and underserved areas, by leveraging our loan and scholarship programs, by recruiting students from the communities that we serve, training interprofessional and collaborative teams, integrating oral and behavioral health into primary care, and community-based training. Next slide, please. Next slide. So here's a snapshot of BHW. So we consist of 11 divisions, including the National Center for Health Workforce Analysis, which analyzes all of our data. With that center, they look at projections for the health workforce from behavioral health, a newly nurse RN survey that was just completed for 2018. And they also analyze our annual performance measures that are reported by our grantees. So today you will specifically be hearing from the Division of Nursing and Public Health and the Division of Health Careers and Financial Support. Next slide, please. So the Division of Nursing and Public Health consists of 3 different branches. We have the Nursing Education and Practice branch, the Advanced Nursing Education branch, and the Behavioral and Public Health branch. So we operate in an annual budget of approximately $225 million that supports academic institutions, clinical facilities, and community partnerships. So our funding mechanisms include grants, cooperative agreements, and contracts. So we have over 600 total different grantees or awardees for FY19. The Division of Nursing and Public Health also operate under Title VII and Title VIII. So all of our nursing investments are Title VIII supported, and then our behavioral and public health programs are supported through Title VII. The Division of Nursing and Public Health also chairs the National Advisory Council for Nursing Education and Practice. And we also lead the Bureau's initiative in opioid and substance use disorder funding and programs. Next slide, please. So for FY20, the nursing education and practice investments that we have, there are 4 of them, including the Nurse Education Practice Quality and Retention, or what we call NEPQR, veteran nurses in primary care. So this program takes veterans that are currently practicing and those that are in school, and we allow them to translate their veteran service to allow them to receive a bachelor's degree with a focus and emphasis on community-based primary care as the clinical site. This is a spinoff of our NEPQR registered nurses in primary care that focuses on the same population, except not the veteran focus, but practicing RNs and students that are in nursing school and trying to get them to work to the full scope of their license and education in community-based primary care settings. We also have our NEPQR interprofessional collaborative practice behavioral health integration investment. So what this does is this integrates behavioral health into nurse-led primary care teams with the focus of the practicing APRN for that program. And then we have our nursing workforce diversity program, which focuses on providing educational opportunities for nurses from disadvantaged backgrounds in all of our nursing programs, from bachelor's degree all the way up to doctoral degrees. Next slide, please. Our advanced nursing education FY20 investments include our new nurse practitioner residency program. So this focuses on putting new nurse practitioners into primary care using a 12-month residency. So they will come in and do a 12-month residency with the hope that they will work in primary care in rural and underserved areas. We have our advanced nursing education workforce program, which supports academic and practice partnerships, again, with a focus on primary care of the APRN and getting them to work in rural and underserved areas. So this program has an infrastructure piece as well as a traineeship piece to get nurse practitioners to work in primary care. Our advanced nursing education sexual assault examiners program focuses on increasing the number of RNs and APRNs and forensic nurses that are trained and certified to be sexual assault nurse examiners in our rural and underserved areas. Then we have the nurse anesthetist traineeship program, which focuses on providing traineeship dollars for RNs who want to become CRNAs. Our current focus in this program is, of course, pain management with a specific on OUD and SUD and how the CRNAs fit into the pain management role within our rural and underserved areas. And we have our nurse faculty loan program, which focuses on the institution creating a revolving student loan fund where the students come in, they receive their master's or doctoral degree and agree to become faculty and get a loan repayment up to 85% depending on their agreed years of service as nurse faculty. Next slide, please. Next, we have our behavioral and public health investments. Like I said before, our division is the leader in our opioid and substance use disorder and behavioral health investments for the entire Bureau. So we have our 5 current FY20 investments. The Behavioral Health Workforce Education and Training Program is one where schools of nursing are eligible to apply, and the focus is on professionals and paraprofessionals and expanding that behavioral health workforce in rural and underserved areas. There's also a supplement to that BWEP program that focuses specifically on opioid use disorder and substance use disorder for both professionals and paraprofessionals where nursing programs were eligible to apply. Our other behavioral and public health investments are not focused on nursing. They are focused on the other behavioral health professions such as doctoral level psychology, as well as our public health training centers focus on the regional public health needs and provides traineeships to students who would like to work in the public health workforce. So at this time, I'm going to go over, next slide, what our investments look like in terms of awards. So in FY19, you have the chart here that shows the number of new awards that we made in addition to our continuations and then our total investments. So we do, again, like I mentioned before, operate at about $225 million per year for all of our nursing investments in our division. So now I'm going to turn it over to Juana Rodriguez, who's going to talk about the Division of Health Careers and Financial Support Programs. Juana?
Thank you. Okay, so today I'm going to talk about the Division of Health Careers and Financial Support. And in the Division of Health Careers and Financial Support here at HRSA, we provide support to HRSA's mission to help serve the underserved through our health workforce programs. Next slide.
Juana, this is
Yes.
Winifred. I'm wondering if you could move a little closer to your microphone, or you sound very distant.
Okay, is this better?
Yes, much.
Excellent. Okay. So with that, this slide shows all of our 12 health workforce programs that reside within our division. Our program covers a wide range from loan repayment, scholarships, revolving loan programs, and grant programs. Next slide. The Nurse Corps works to aid the country's shortage of nurses through supporting nurses in scholarships and loan repayment. Currently, over 1,900 Nurse Corps nurses are working that provided nurse care to critical shortage facilities across the country. We work hard to help alleviate the nurse shortage through our programs and are always looking to alleviate the Nurse Corps Scholarship Program to align with the greatest needs that are out there. Next slide. We have 4 programs within our Health Career Loans and Scholarship branch that provide revolving loans to health professional schools to help those students in financial need. These programs cover a wide range of health disciplines. There are no annual appropriations for these programs. They have been in existence for many, many years. As loans are repaid, the funds are re-awarded. Next page. Nursing student loans, also NSL, is one component of the Health Careers Loans Program within the Division of Health Careers and Financial Support. For more information, we will make sure to leave a link at the end of these slides. Next slide. Our pipeline program branch does tremendous work to support initiatives that aim to increase the diversity of the nation's health professions workforce. These pipeline programs include the Area Health Education Centers, the Centers of Excellence, Scholarships for Disadvantaged Students, and the Health Careers Opportunity Program, as well as the National HCOP Academies. Next slide. Here you can see our FY19 investments for our programs. Our division has a healthy budget and we have approximately 45 staff to support our mission. We are proud of the work our division accomplishes each year. As you can see, for the loan repayment, we're at 52.6 million. The faculty loan repayment, 1.1 million. The Nurse Corps Scholarship, 23.5 million. Native Health and Hawaiian Scholarship, 1.23 million. Health Career Loans and Scholarships, 32.3 million. And Health Careers Pipeline Programs, 117 million. Next slide. Here you will see a slide with our current notice of funding opportunities within the Bureau of Health Workforce with their respective deadlines. You will also be able to click on the link to get more information regarding each of these announcements. Next slide. For more information on nursing grants, please visit the link attached. For more information for school-based loans and scholarships, you can visit the link attached as well. Next slide. Additional HRSA nursing investments include the maternal and child health pipeline training. Next slide. The maternal and child health pipeline training programs promote a culturally diverse healthcare workforce by recruiting undergraduate students from economically and educationally disadvantaged backgrounds into maternal and child health professions. The pipeline program recruits undergraduate students enrolled at institutions that have demonstrated a record of training individuals from disadvantaged backgrounds who are underrepresented in maternal and child health populations. Next slide. The Maternal and Child Health Pipeline Program has been funded since 2006, and since 2006 has had over 700 graduates. Grantees partner with MSIs to recruit and retain racially and ethnically diverse undergraduates who are interested in maternal and child health professions. Some of the outcomes: in FY 2016, 71% of graduates entered graduate programs preparing them to work within the maternal and child health population. That was a 6% increase from the previous year. Over a 5-year period, the aggregate percentage is 68%. In FY 2016, over 100% of maternal and child health pipeline trainees were from underrepresented racial and ethnic groups. Graduates have entered graduate school to pursue degrees in public health, medicine, nursing, pharmacology, social work, physical therapy, occupational therapy, dentistry, psychology, and communication disorders and services. Next slide, please. At this point, we would like to open up the lines for any questions or comments that you might have about any of the programs that you've heard here today.
All right, thank you, Juana and Tara. At this time, I'm gonna unmute all the phones. So if you do have a question, please let us know. And the lines are now open, so please feel free to ask a question.
So this is Winifred. How often do the notices go out each year for different types of funding?
So this is Tara. So it really depends on the program. Of course, everything is based on congressional appropriation and how that comes down. And so depending on the level of funding will determine kind of if there is a full-blown competition or not. So like, let's say if there's a program where there's a surplus of $1 million, we really have to look and see, after we take admin costs out of that, is it worth having a full-blown notice of funding opportunity for funding? So it really just varies. Some are every 3 years, but then we also have our revolving programs like our nurse faculty loan program, which is revolving, so it's every year. Our nurse anesthetist traineeship program used to be every year as well. So we have some that are traditionally every year, and then we have some that are every 2 years, some that are every 3, and then we can have programs that range up to every 5 years. But traditionally, we stay around the every 3 to 4.
Yeah, hold on. I'm on this meeting here.
Folks, if you have a visitor in your office and you're having a conversation, can you mute your line? Okay, thank you, Tara. So a second question, and now I'm going to try to bring it more into the mentoring programs that the HBCUs are doing. So do you think, for the purpose of helping undergraduate students remain in school and graduate, would the nursing workforce diversity program be, do you think that would be an ideal one for the schools to look out for?
So the Nursing Workforce Diversity Program has 5 main kind of elements that fall under it, in which the awardees are required to implement. And one of those is being mentoring. So it's both peer faculty and professional mentoring. So that's definitely something that we know is evidence-based, and we know specifically helps students from disadvantaged backgrounds able to stay in nursing school and then graduate and then move on to pursue graduate education as well. So definitely that would be one. I think for all of our programs, in the ideal world, we would want to have some type of mentoring component, especially at the undergraduate level, but even at the graduate level, we think that mentoring is a very important component. And most of our pipeline programs, if not all of them, have that mentoring component where as a required activity of the grant.
Great.
This is Juana. I just wanted to also mention, be it for notice of funding award announcements or scholarship opportunities, you can always sign up on the HRSA website, and then you will automatically know what's going on and what's coming out and what opportunities are becoming available.
And I would also do the same thing in grants.gov, so that if there are awards that are forecasted, if there are notices of opportunity that come out, you will be notified about those as well.
Tara, can you repeat that website again?
Or it's grants, grants.gov.
Great, thank you.
You're welcome. And that's going to be funding. I mean, you can specify which agencies or which opportunities you want to be notified about, but that's a website that it's used all government wide. So it would be all of the government grant opportunities. And like I said, you can specify it to be individualized to the ones that you receive notification about. But all of our opportunities that are either forecasted or posted come through grants.gov. That's the platform that you will use to apply, as well as keep track of what's out there. We also have on our BHW website, we also, have our tracker in terms of grant opportunities that are posted, as well as access to those that have been closed. So you can always go back and access a previous opportunity, as well as see the ones that are actually open. And it's not just BHW. At this point, they've added all of the HRSA programs to that website that you can search.
Great. So what are your thoughts about schools of nursing applying together for a grant?
I mean, we definitely, we focus on partnerships as well. That's another component of most of our grant programs for nursing. We definitely encourage partnerships. There has to be one lead applicant though for all of our programs. So you can't actually co-apply, but you can definitely partner and leverage the funds. So one entity can be listed as the lead to apply, and then you guys can split, the funds 50-50 or however it works, whatever that partnership looks like. We definitely encourage partnerships because we know that leveraging those resources will yield better results for everyone. So we definitely encourage that and working together as well. So if 2 or 3 of you are funded in the same state or the same region, even leveraging that and providing access and a pipeline and kind of that learning of best practices and what's working and what's not working is also encouraged.
Great.
Thank you, Tara.
You're very welcome.
Want to open it back up to questions. If anyone has a question, please feel free to ask. And I know some people have muted their phones again, so if you are trying to ask a question, please unmute yourself.
And how do they unmute themselves?
Um,
Oh, they just use the symbol,
yeah,
the icon.
The icon, yeah.
Okay.
I have a question. Can you hear me?
Yes, is that Karen?
Yes. So if you are with a new program, are the students eligible to apply for any funding?
So if you are a new program,
Yes, we're a new
Have to
BSN
have-
completion program.
so if you are a new program and is that in terms of you don't have your full accreditation yet? Is that the question that you're alluding to?
Right, so we don't have our
Yes.
national accreditation yet.
So what you would have to do is go through the Department of Education and get a letter of reasonable assurance that states that though you don't have your accreditation, it's looking like you will have it during the period of project performance. And that is something that you would submit with your application. So you would have to actually reach out to the Department of Education to get that documentation to include with your application.
And you said reasonable assurance?
Yes.
Okay. Thank you.
You're very welcome.
Other questions?
And please be on the lookout. We do have a couple of nursing programs that are forecasted to compete this year. We don't have all of the details flushed out yet, but I know that specifically from my division, we're looking at maybe 4 to 5 opportunities that are being forecasted for FY20. So just keep posted on grants.gov to receive notification about that. But we are looking forward to having some additional investments in 20 from some of our programs that were not going to originally compete in FY20.
Thank you, Tara.
You are welcome.
Just seeing if there's any questions that came in through the chat box.
So, so there were no more questions. There were no questions in the chat box.
No.
Okay. So maybe we could wrap up.
Okay.
Oh, I do have one more question. So Tara and Juanita, are people able to contact you directly if they have questions, or what is? Do we have information on,
Yes,
on any of the slides?
if we go to the next slide, there is a slide that has both of our information. So
Great.
see Tara Spencer's information, and then you'll see my information. So you can definitely contact us directly for any questions about anything that you have seen today.
Okay, that's great. That's super. So, well, do I have a follow-up? Do I have a final? Okay, I have a final slide. Scott has given me. So, on behalf of the Campaign for Action and Sue Hassmiller and Susan Reinhardt, I want to thank Tara Spencer and Juanita Rodriguez again. And I also would like to thank Captain Kavanaugh, who was going to be with us today, but she was deployed. So Juanita, thank you for stepping in and for planning to be on call if needed, and in fact, you are needed. So, and Tara, also, thank you so much for your leadership and support in the Campaign for Action, and our support of our mentoring work with the historically Black colleges and universities. We will be having two other sets of trainings with other minority serving institutions. We'll be convening in Miami with Hispanic serving schools this summer, and sometime later this year with a set of Native American serving schools. So FYI, just to let you know that. And but Tara, you're the one that really saw and made the connection and joined us in person in September and have continued to follow up to make sure that the HBCs are getting the support that they need and deserve. So I thank you so much for your leadership in that effort.
No problem.
And thank you both so much for joining us today. So let me, that was my impromptu comments, but this is what Scott wanted me to tell you. So as we mentioned at the beginning, if you miss a section of the webinar or would like to pass it on to a colleague, which we encourage you to do, you can find the recording and the webinar summary and additional webinar resources by going to www.campaignforaction.org/webinars. And also be sure to follow us on Twitter, join us on Facebook, and when I say us, I'm meaning the Campaign for Action. And we also have a weekly update, which is, it's actually a bi-weekly update. It's called the Campaign Update, and we send it out every other week. And the way to register for that or to find out about any of our upcoming events is by scrolling down to the bottom of our front page on our website, and you could sign up for whatever resources you think would be of value to you. So that's it. Thank you so much for joining us, and thank you all for all of the work that you do.